Okay, Ricky Martin, everyone's talking about his face. Now, he did an interview recently of his upcoming shows. Here's the picture here, and here's him 1 year ago. And people are saying he's unrecognizable. I don't think he's unrecognizable, but who does it remind you of? Zac Efron recently. Now, what do we see in the pictures? A bloated face or a larger face? What are the possibilities here? Everyone wants to blame it on fillers, of course. Who did this to him? What doctor could have done that to him? You hear that all the time now. I want to point out a couple things. If someone's doing filler for somebody, what are they going to also recommend? Typically Botox or products that stop or slow down muscle movement. But look at his frown. Like mine, you can see that he's frowning. Now, we can also look for headlines. So if he went somewhere and got fillers that were bloating his face, chances are they would have addressed this area too. And when I went back and looked at other pictures, you can see when he's making the same expressions as he did in the interview, that there seemed to have been less movement indicating prior Botox-like treatments. Now, a key is looking at the eyes. Now look at the hooding. It's much more dramatic now. There's more hooding over the eyes. That signifies a couple things. One is collagen loss, a dramatic change in collagen, increased hooding, or fluid and water retention. In 1 year, there usually has to be a reason. And for men, typically you don't get that big hormonal dive like you might get for females that might account for it. So I'm saying if you look at his neck, he looks bigger. We can't tell unless we saw him without his clothes if he's more cut, so something indicating steroid, growth hormone, something like that, or if he gained generalized weight. A third option would be steroids for therapeutics. That increases appetite. It also increases weight gain and water retention, and that can account for an increase in facial size. Now, if it was fillers, and so there would be no toxin done, we know that, unusual, but let's say it was, it could be, but there's global volume. What stands out the most is the anterior cheek, and that happens to be where a lot of people, of course, add fillers. So that is a possibility, but they would have had to add something like a Profilo or skin boosters. I don't believe that there's one surgery or a post-surgical recovery here. It just doesn't look like that. So I'm going with something global, something like therapeutic steroids, something like systemic steroids, something to build his body, or generalized weight gain, because there's overall collagen loss and aging that we see. We'll find out soon, but I want to know what your thoughts are. What do you think is leaving him what they say is unrecognizable? I don't think he's unrecognizable. Certainly, he had a more sculpted look before. What say you? What do you think that he had done?